Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Shwas Vyadhi, and in that regards, I shared my experiences with you that whenever there is Shwas Vyadhi, Kuluja factor is yes important, but many a times or most of the times you will find a triggering factor in the lifestyle which may be ahar like cold food, cold water, or vihar like day sleep, etc. But that triggering factor you have to know, and for that you take the history or dinacharya of the patient in detail. In that background, the Chikitsa Sutra of Shwas Vyadhi is very much important. Yat kinchit kaphavatagam ushnam vatanulomanam. Yat kinchit is a very important word. Yat kinchit means anything, any small, big, anything which is kafagna, vatagna, ushna viryatmak and which will make vayu anuloman. Anything which is kaphavatagna, वातानुलोमक उष्णवीर्यात्मक भेषजम अन्नपानम च that anything may be a medicine or may be a ahar. So any ahar which will be kaphavatagna ushnaviryatmak and vatanuloman will be helpful to the patients of Shwasa Vyadhi. See, this is beauty of Ayurveda. When Ayurveda says that mithya ahar is a cause of the disease, mithya ahar, mithya vihar, the other side of this coin is if mithya ahar is the cause of the diseases, then proper ahar will be the solution of the diseases. Hope you understand. If mithya ahar produces diseases, then proper ahar will be helpful to reduce the disease. So here ahar, a proper ahar which is kafagna, vatagna, ushnaviryatmak itself works as a treatment. You may call it as a ahara chikitsa. In the case of Shwas Vyadhi, when there is a solid history of the Shwas and you find a Kuluja Itihas also, this ahar which is kaphavatagna ushnaviryatma, you can use this gunatmak ahar as a treatment. Hence, you give medicines, no doubt about that. But if you ask the patient to follow this yat kinchit kaphavatagna ushna vatanulomak ahar throughout the year, or at least when there is exaggeration of asthma in rainy, before that, if you ask the patient to follow this ahar, this gunatmak ahar as much as possible, then intensity of the Shwas Vyadhi will remain under control. If you convince the patient to take such ahar throughout his incorporate such ahar in the lifestyle regular basis, then you will find that attacks of the Shwas Vyadhi or Vegavastha and also intensity of that Shwas remains under control, or it is very much on the lesser side. Hence, this pathya you should convince to the patient for his to prevent the Shwas Vyadhi when there is a strong history of Shwas. I know I was discussing about the Kuluja history and how we can deal with the family history of Shwas. But before that, I want to share a very good case of Shwas I have seen because in last episode I told you that you have to differentiate between Shwas Vyadhi and Shwas Lakshan. Hence, the taking of history is very much important. Taking of family history is important. I saw a patient, 65 years old lady. They were retired and they came to Pune after retirement. They took the flat, and after 3-4 months, that lady started breathlessness. Now there was no any family history. Through 65 years of age, there was no any such happening in her body. So naturally, the first reason which came into mind that maybe a change of environment, because Pune is the uh, polluted city. Also, the house they they were living was in a congested area. So naturally, it was okay. It is allergic or because of pollution, etc. When breathlessness was the symptom developed, it started suddenly and it was constant. When I saw the patient, it was almost one and more than 1 year she was suffering from that. Seven doctors in her own family having hospitals in metro cities in Maharashtra. In each hospital of the relative, she was 2 months, 3 months for the treatment. All the investigations were done, right from the lung biopsy, CT scan of the lung, chest, etc. But no one could find the answer why this is happening. Of course, treatments, all types of treatment were given, like say antibiotics or anti-allergic, and all other pathy were also tried. The symptom of breathlessness was not exertional, only there was deep, heavy breathing like that. And she used to talk okay, she used to work in the house, but constant increased numbers of breaths 24 hours. Now lungs were clear, biopsy was clear, nothing, no one was able to diagnose what is actually caused, which started suddenly without any family history. After 1.5 year, almost, by treating all these treatments and investigation, in the one of the hospitals in Mumbai suggested total body scan. Now symptom was of lung and everything was normal, but they suggested let us do a PET scan of whole body if something is not is remaining. In that PET scan, they found a tumor which was on the respiratory center, and that tumor was pressing the respiratory center, and that's why continuous breathlessness was started. Why I am telling you this interesting case? This is rare case, but when I am telling you that you should differentiate the Shwas Vyadhi and Shwas Lakshan is for that purpose. Now, if I didn't saw these reports, or if I just blindly followed this is Shwas Vyadhi and giving Vaman or any other thing, it is not going to be useful because the root cause is different. It is in the brain. So, in that case, you have to treat Shwas as a Lakshan, and you have to treat that brain tumor as a main Vyadhi. Hence, friends, whenever patient comes to you, always take the history in detail and find whether it is a right from birth, a family history, or it has started suddenly without any history in the past. Because the treatment totally differs on Shwas Vyadhi and if Shwas is a Lakshan. So, hope you have liked this case. My point of discussion, which was I ended in last episode about the collagen history and how we can, if we can prevent it or not. If yes, how we discuss in the next episode. Thank you very much.